Hey guys, it's Dr. Paul at Wichita Dental Group. Today we're going to talk about toothbrushes. So we've got a couple of toothbrushes here that we recommend or that we get out at the office. And so we're going to talk about why we give them out, what to look for in a toothbrush, and then also how to brush properly. So we've got two toothbrushes here. One is Gum brand, G-U-M. The other one is Oral-B brand. So I'll talk about the Gum one first and why we like it. The reason that we like this brush is because of the bristle design on it. When you're looking at a toothbrush, you want a toothbrush that has really soft, flexible bristles. There's some toothbrushes on the market that have pretty coarse and inflexible bristles. Those don't clean quite as well. This has the ability to get around the edge of a tooth and also along the gum line and clean better. Also, with your toothbrushes, you want to look at either a soft or extra soft toothbrush. So this is a soft toothbrush. This is a toothbrush from Oral-B, and it's extra soft. So this one is even softer than this toothbrush is. The reason you want to look at those is because you can actually have a toothbrush bristle that's too coarse, and that can either abrade the gum tissue or it can even abrade the tooth structure as well, and you can actually rub away the tooth structure if you're continually brushing years over years with that toothbrush that's either medium or coarse. They'll usually have coarse, medium, soft, extra soft, and those are kind of the levels. So again, soft or extra soft. So we'll go over the actual technique on how to brush. So we've got a model here and a couple of toothbrushes, so we'll go over that. I'm going to hold this toothbrush here just on the outside edge without any brushing, but show you kind of like, okay, why do we like having a toothbrush that has softer bristles and more flexible bristles? So I want you to see how the bristles of the toothbrush can actually get in between. I'm looking right here in between where the teeth meet, and it can get in between the teeth just a little bit. If you have a more flexible toothbrush bristle, it's going to reach further in there than if you had a really stiff bristle on this toothbrush. So brushing the outside of the teeth, you're just going to want to make small circular motions on the outside of the teeth and then working forward. Same thing on the inside, small circular motions working forward, and then also on the biting surface. And then these bristles, since they're more flexible, they're actually going to get in between the grooves of these back molars. That's one of the most common areas where we'll see cavities form, is back between all these little grooves on these back molars. When you're brushing, you want to feel the toothbrush bristles actually touching the gum tissue just a little bit, because one of the most common areas where you'll see plaque build up is people really do a good job of brushing the outside part of the enamel surface of the tooth where it's very broad. But one area where plaque can be left behind is just right along the gum line here. That area is a very common area as well where the plaque gets left behind. So you actually want to feel the toothbrush bristles both on the tooth and on the gum tissue just a little bit. How hard do you want to press when you're brushing is another pretty common question we'll get. If you see the toothbrush bristles really splaying out, you're pushing too hard on the toothbrush. You want to just gently hold it and kind of let the bristles do most of the work of getting the plaque off of the teeth. So very gentle pressure. I'll show you a common kind of trouble area. People will frequently get a lot of tartar or plaque built up on the back side of these teeth. So when you're brushing, you'll go along the side of the tooth. If you have a larger toothbrush kind of head size like this one, a common area that can be hard to reach is on the back side of these teeth, because the bristles don't actually reach all the way to the tooth. You can get blocked by just how large the brush head is. So you have to change the angle of the toothbrush, and on the back side of these teeth, you actually have to brush vertically a lot of the times, okay? Another way that you can fix that is, this is the Oral-B toothbrush. And it has a little bit smaller head size compared to the gum toothbrush. Get a toothbrush that has a smaller head size. Generally speaking, a smaller brush head is going to be better because you'll be able to reach more areas with it. So with the Oral-B, you can hold it horizontally and you can still reach the back side of these teeth pretty well still. So smaller toothbrush head size or holding the toothbrush vertically and brushing vertically. And that goes for the bottom front teeth as well as the back side of the upper teeth as well. So You'll be able to get the inside just fine in the back, but a lot of the times you have to change the angle and brush a little bit more vertically on the back side of these front teeth in order to get the whole area. Another toothbrush I was going to discuss, this is a little bit more of a specialized toothbrush, so not necessarily everybody would need this toothbrush or would benefit from it, but that's an End Tuft brush. And so I'll show you this one. The good thing about this one is that it's much smaller. You would not use this toothbrush to brush everywhere in your mouth, but this is for hard to reach areas. So again, this is a gum brand End Tuft brush. And you can see here it's a lot smaller toothbrush, and so you can get it into areas that are hard to reach. If you were using this to brush everything, it'd take you forever, but the spots that I really like to have patients brush with this if they're having trouble getting into a certain area is going to be the very last molars, and then also the backside of these front teeth as well can be a good spot. But this toothbrush, you can reach it in and actually get the back side of these lower teeth. The very last molar on the back side of the very last molar can be a hard spot to reach. And so these End Tuft brushes can do a really nice job of that. They can also get on the back side of these lower teeth really well. So if that's a trouble area, it can be another good spot. A third situation where these can be really nice is patients that have like traditional braces, brackets and wires. We don't have a model that has those on their teeth, but if you can imagine, this would get underneath the wire that's on the teeth, and it can get underneath it, so you can kind of come from an angle underneath the wire, or you can come from the top down as well and get around those brackets and wires to really be cleaning well underneath that. Another situation where an End Tuft brush can work really well is in patients that have bridges. So a bridge is a tooth replacement option when you're missing a tooth, and essentially the back tooth and the front tooth support a 3-tooth bridge. So a bridge is essentially 3 crowns that are fused together. So this patient would be missing this middle tooth here, and then the back and front teeth are prepared for crowns. And then you have a bridge that then is a porcelain bridge that's cemented onto these front and back teeth. So that helps replace that missing tooth here. The problem with bridges is that it's really hard to clean in between the missing tooth and then the front and the back teeth, because you're not able to actually floss down through a bridge because those crowns are all fused together. So an End Tuft brush, you can get between, and you probably won't go all the way underneath the crowns here, but you can get in between this area a lot easier with an End Tuft brush than if you had a regular size toothbrush. This probably will not reach in between the teeth as well as this would. So patients that have bridges can also use this to really clean in between there. Another common question we'll get is, how often should I be changing out my toothbrush? You should change out your toothbrush probably every 3 to 4 months. So you should be going through 3 or 4 toothbrushes per year. You want your toothbrush bristles to look like this. If you notice that they start to get really splayed out and frayed, it's time to change your toothbrush. The cleaning efficiency is going to go down a lot on a toothbrush where the bristles are all splayed out versus one where it's nice and compact and looks like this. So that wraps up manual toothbrushes and End Tuft brushes. If you want to learn more about pediatric toothbrushes, just click here.
In front of your face?